In conclusion of this course, we will provide 10 recommendations for MSLs, medical managers, advisors, and all roles in field medical teams within medical affairs. 10 important recommendations for MSLs. 1. Stay informed. Continuously update your therapeutic area, knowledge base with the latest clinical data, industry trends, and competitive landscape insights. 2. Lifelong learning. Invest in personal growth through ongoing training and education to stay ahead in your field and add value to your organization. 3. KOL engagement. Establish and maintain robust, transparent, and ethical relationships with key opinion leaders, KOLs, through consistent and valuable scientific exchanges. 4. Understand compliance. Have a thorough understanding of compliance regulations and ensure all interactions and engagements are within legal and ethical boundaries. 5. Enhance communication skills. Develop excellent communication skills to effectively convey complex scientific information in a clear and impactful manner. 6. Leverage technology. Utilize CRM and data analysis tools to track engagements and outcomes, ensuring efficient management of KOL interactions. 7. Cross-functional collaboration. Work closely with other departments, such as marketing and commercial, to align on strategy and share valuable insights from the field. 8. Patient-centric approach. Always prioritize patient outcomes and understand how your role impacts patient care and access to therapies. 9. Strategic planning. Participate in strategic planning to identify opportunities for scientific engagement that align with company goals and KOL needs. 10. Feedback loop. Create a systematic approach to gather and report feedback from healthcare professionals to inform medical and business strategies. Good luck and best wishes.